2 days into the country's COVID-19 vaccination program, the government boasts that the rollout has been successful, with more healthcare workers getting vaccinated than initially expected. But hospitals in Pasig and Marikina recorded a low turnout. Let's check the situation at one facility in Quezon City with Doctor Norberto Francisco of the Lung Center. Doctor, thank you so much for joining us. What is the latest on the number of healthcare workers vaccinated at the Lung Center?
We have a total of 54 as of today. And tomorrow we expect the same number to have themselves vaccinated. They have enlisted already for tomorrow's schedule.
So, Doctor, have any of those 54 that have been vaccinated felt any kind of side effects?
Not significantly. Some of them, a few of them, experience what we call a reactogenic effect of the vaccine. And this is part of the normal reaction of the vaccine. But one of them had an episode of vomiting and high blood pressure just today. But we've traced that not to the vaccine, but to the face shield she was wearing, because she got dizzy from the plastic of the face shield she was wearing. It was probably worn down. And her reaction was that after she threw up, she felt all right immediately. And that's not the kind of reaction you get from an allergy or a reactogenic effect of the vaccine. Otherwise, all of them are doing good. In fact, we had one employee who had a history of severe allergy before, an anaphylactic reaction to a drug. And today she got a vaccine, and the critical time for an allergic reaction is 30 to 60 minutes, more of 30 and earlier. And I spoke to her late this afternoon, and she was doing all right. And that was something like 6 hours after she had the vaccine.
So with the 20 yesterday and the 34 today, that totals 54 who have been vaccinated with Sinovac. When will they be receiving their second doses? Will it be in 14 days or 28 days?
3 weeks.
So basically in between, 21 days.
21 days.
So 20 plus 34, and you're expecting much more tomorrow, the third day of this vaccination drive. Are you trying to say then, Doctor, that confidence is starting to improve for healthcare workers within the Lung Center of the Philippines to get inoculated with this Chinese vaccine?
I would like to think so. And also the effect of our information campaign and our information drive. We have been educating them with pure facts.
And Doctor, Tristan Nodalo just reported earlier that there are now cases of the South Africa variant in Pasay City. This is just around our neighborhood. What have you been told about the efficacy of this Sinovac vaccine against the South Africa variant, which is more contagious, by the way?
Yet. Well, we don't know much yet with the South African variant. We have very, very little data with that. But hopefully with the kind of mechanism of Sinovac, it involves an inactivated virus, the whole virus. And some experts have mentioned that it has a broader effect on variants compared to the others.
Because
this is a theoretical basis.
Indeed, a theoretical study. But there have also been studies on the Pfizer and the Moderna and the AstraZeneca that they are they're as effective as the original COVID-19 variant against the UK and the South Africa variant. So with the presence now of the South Africa variant in Metro Manila, will your close to 1,000 employees, you think, wait for these Western vaccines to arrive to get themselves inoculated rather than this Sinovac vaccine, which still lacks data if it is indeed effective against the South Africa or the UK variant?
Well, that's the minority variant as of now. We have to address the main COVID variant, which is really causing deaths. So we still maintain what the government and what the experts have been advising, that you have to get the vaccine which is available to you and which is recommended for you at the soonest time, because we really cannot afford to wait. We don't know when the others are coming in the first place. And meanwhile, our risks is always just in front of us, day in and day out.
And the hope is that more of these vaccines will arrive sooner rather than later to help
That's
our
correct.
people fight against this COVID-19 fight. Thank you so much for joining us on The Final Word, Dr. Norberto Francisco from the Lung Center of the Philippines.